Dear students, the main objectives are to know about the concept of assisted reproductive techniques, to understand about the artificial insemination and superovulation methods, to explain in vitro fertilization and embryo transfer technique, to know about the gamete or zygote intrafallopian transfer methods, and to understand the intracytoplasmic sperm injection. Introduction. Fertility is the state of inability to conceive a baby. Problems can be observed in both men and women. Women have about 10 to 14% chances of being infertile in Indian population and 15% chances in the United States. There may be many factors responsible for infertility. In most of the cases, if the parents are at old age or in case of delayed marriage, the problems occur in having a baby. In some cases, the sexually transmitted diseases or infections can affect the parents. Some parents can plan for a baby after a few years of marriage, and they can use birth control methods or hormonal contraceptions. In those cases, they find it difficult later to get conceived. Abortions and obesity conditions can also result in infertility. Environmental conditions also play a role in a person's health. Pollution can also act as a risk factor in increasing infertility. The assisted reproductive technologies bring hope in couple to overcome the problems of infertility. There are many methods include under the assisted reproductive technology. They contain artificial insemination, in vitro fertilization and surrogacy, etc. All the methods bring the new options for the reproduction process in humans. Hence, this episode is further explained in the following aspects. A. Assisted reproductive technologies. B. Artificial insemination. C. In vitro fertilization and embryo transfer method. D. Gamete intrafallopian transfer and zygote intrafallopian transfer. E. Intracytoplasmic sperm injections and assisted hatching techniques. F. Ethical issues in art. Many infertile couples seek for the art to overcome the problems. The birth of Louise Brown in July 1978 was one of the milestones in the method of in vitro fertilization. It is also called as IVF. In 1930s, Gregory Pincus was one of the brilliant scientists in biology who achieved in vitro fertilization for the production of the first animal, the rabbit. He found success in the assisted reproduction in humans. He successfully invented the first oral contraceptive. During the 1950s, John Rock was another gynecologist who created the first birth control pill, the pill. Rock agreed for the approach by Gregory Pincus to give a trial for the pill. Rock conducted the human trial for the pill, and in 1960, the pill got approved by the FDA. Similarly, in 1984, the first birth of baby done using the gamete intrafallopian transfer is also called as GIFT, and in 1986 using zygote intrafallopian transfer, is also called as GIFT, was successfully done. The leading technologies in reproductive assistance are as follows: artificial insemination method, in vitro fertilization method and embryo transfer, gamete intrafallopian transfer, zygote intrafallopian transfer, intracytoplasmic sperm injection, and assisted hatching. People can have some kind of infertility due to the problem with uterine functions, that is cervical mucus problems, endometriosis and azoospermia conditions, or poor ejaculation of sperm, etc. In those cases, the artificial insemination techniques can help them to overcome the problems. This biological technique promotes the conception by inserting the semen of male directly into the female genital tract by using a syringe or other tubes. In 1900, this method has been used in the animal breeding to improve the quality. Artificial insemination can be done in the following two types: intracervical insemination, is also called as ICI, intrauterine insemination, IUI. Both the techniques help to overcome the problems like prevention in vaginal ejaculation, low sperm count, poor mortality of sperm, and no production of cervical mucus. Intracervical insemination is the method of inserting the freshly collected semen directly into the cervix by using a syringe or long slender tubes. The chances of success rate are 2%, which is less than IUI. Intrauterine insemination is the method of placing or inserting the freshly washed semen directly into the uterus using catheter. Since the semen is directly introduced into the uterus through the cervix, the chances of success rate are 5 to 20%, which is more than ICI. The success rate can even be more if the artificial insemination is done with the help of superovulation. Superovulation is a method of producing more number of eggs or ova. The gonadotropic hormones are used to stimulate the ovulation of a large number of eggs. The initial step in superovulation is to administer medication that increase the number of mature eggs. The medicines are administered by either orally or injection. If the drugs are taken, then it is essential to monitor the ovarian response to the drugs. This can be followed by ultrasound. Method of sperm extraction. Sperm sample or semen can be collected by masturbation or aspirated by using surgical techniques. The extraction of sperm sample carried out only when the ejaculation through the penis is not possible. The following types of methods can do the extraction of sperm: microsurgical epididymal sperm aspiration called MISA, percutaneous epididymal sperm aspiration is called PISA, testicular tissue sperm aspiration called TISA. Microsurgical epididymal sperm aspiration procedure can be used for the conditions of azoospermia and absence of vas deferens. This procedure involves the dissection of the epididymis, long coiled tubes that stores the sperms. This procedure is conducted under the operating microscope. A small incision is made on the tube. The spill out fluid from the tube is aspirated. The procedure is undertaken carefully without affecting the tissue, because little contamination may lead to loss of sperm fertility. Percutaneous epididymal sperm aspiration is another way of collecting sperms from the epididymis, where it does not conduct by incision. A thin needle is directly injected into the epididymis through the scrotum layer. The fluid is aspirated and separated sperms from the fluid. Testicular sperm aspiration is done by inserting a needle into the testis. Fluid and the tissue are aspirated from the testis. The aspirated tissue is then processed to separate the sperm cells from it. Procedure for artificial insemination. The female is carefully examined for the physical conditions. The exact date for her ovulation period is determined before the procedure, and during her ovulation period, the procedure is conducted. The fresh semen sample is collected from the male partner or another donor in case of problems with the male partner. The semen is released into the woman vagina or uterus using a slender tube which is attached to the syringe. The insemination is done during the release of the ovum. The woman is then advised to lie for half an hour or 1 hour to prevent any disturbance and to allow the fertilization. After few weeks, woman is tested for pregnancy. After the procedure is done, woman may feel discomfort. In some cases, bleeding may occur by the tissue damage. This method is common and well known in assisted reproductive technology. Initially, it was known as the test tube baby technique, used in the successful birth of a baby in 1978 by two British physiologists, Patrick Stevepole and Robert Edwards. This method can be used for many infertility cases. Some of the causes of infertility are tubal infertility, means damaged fallopian tube, non-functional ovary in case of woman, and reduced sperm count, means oligospermia in case of men. The process of fertilization of egg and sperm in vitro is carried out by maintaining the sterile environment and other sterile tools. Once the fertilization is done, then the embryo is transferred to the uterus of a woman. Procedure. Woman is monitored and given follicle stimulating hormone soon after the menstruation to produce secondary oocytes. Administration of luteinizing hormone is done to ensure the maturation of oocytes. The administration of human chorionic gonadotropin can be done by injecting for the ovulation. Then the oocytes are collected by laparoscopy, which is a surgical method of making a small incision and monitored by the ultrasound. Collected oocytes are transferred to the cultured medium consisting of fluid which mimics the fallopian tube fluid and other nutrients. A large number of sperms are collected from the partner and added to the same culture medium with oocyte. This will allow for the fertilization to occur. The fertilized eggs are then taken and transferred to the other medium to develop. In about 4.5 days, the embryo will reach the early blastocyst stage with 8 to 16 cells or blastomeres. Later, 2 or 3 embryos are selected and they will transfer to the woman's uterus for further development. Other embryos can be preserved for future use by the method of cryopreservation. Then the woman is tested after a few days for the pregnancy. Advantages: this technique will help to bear the baby in case of infertile couples. By the selection of embryos may help in the production of superior quality. The embryos can be preserved for future use. Factors affecting the in vitro fertilization. A. Maternal age. Age of the woman matters a lot to bring successful fertilization. As the age increases, the eggs become older and several productions of the eggs become less. B. Quality and quantity of the embryos. In some cases, the proper fertilization may not occur and hence the quantity becomes less. Older eggs show poor quality of the embryo. C. Previous treatments. The fail of this method may occur by improper conditions or by many failed treatments. D. Sperm count and morphology. The count of produced sperms may become reduced and not enough to conduct the procedure. In some other cases, the produced sperms may show improper morphologies and they may not fertilize with the ovum. E. Problems with a uterine wall. Conditions of the uterus lining are essential for the implantation to occur. The possibility of implantation rate is about 20%. If the condition of the uterus is not proper, then the implantation rate will decrease. Risk factor. Some of the medications may bring allergic reactions. Injuries may occur by the needle aspiration. High chances of miscarriages. Problems may occur by the anesthesia. Hyperstimulation of ovaries by the hormone injection. The gamete intrafallopian transfer method is carried out by collecting the oocyte after the ovarian stimulations and place with the collected sperm from the male. Then the mixture of ova and sperms are inserted into the fallopian tube. The placing of the mixture can be done by laparoscopy. The fertilization will occur in the fallopian tube as a natural process, and further development occur inside the uterus of woman. This method is beneficial for the couple who face specific forms of infertility. This is the simple method, but not that effective as the in vitro fertilization. The intrafallopian zygote transfer is the similar method as GIFT and IVF. In this case, the fertilization of the reproductive cells will take place in vitro. The oocytes are collected after the ovarian stimulation by the transvaginal ultrasound guided method. Both collected fresh semen and oocyte are incubated together in the lab condition for the fertilization to occur. After the fertilization, the formed zygote are transferred to the fallopian tube using a laparoscope. Both the GIFT and GIFT methods play an essential role in infertility cases and cheaper than IVF. Intracytoplasmic sperm injection is the method of injecting the sperm into the female ovum. This technique usually has done using microinjection in laboratory conditions. In some cases, the sperm may not fertilize with egg and show problems in penetration through the zona pellucida, the transparent layer which covers the ovum. In those cases, this method finds more help to overcome the problems by direct injecting the sperm into the cytoplasm of the egg. This method is used in some cases of infertility in males, showing low sperm count, or severe cases of abnormal morphology of the sperms, teratozoospermia, or poor mortality of the sperms. This method can be used as an alternative method if the patients do not find solution or success in the in vitro fertilization. Procedure: the woman is monitored and treated with medications for superovulation. The sample of semen is collected from the partner either by masturbation or through other extraction method from the epididymis or other parts of the testes. The collected sample is washed and the oocyte are obtained and examined for the maturation. The sperm solution is placed in a petri dish along with the oocyte. Under the microscopic observation, 2 pipettes are taken to hold the egg and to inject the sperm sample. The egg is kept at one side to prevent the movement or other disturbance, and single selected sperm is aspirated into the other pipette and injected into the egg cytoplasm slowly. The sperm injected egg is then examined for the fertilization at 12 hours and cleavage at 24 hours. After 2 to 3 days, the embryos will be ready for the transfer into the uterus of a woman. The embryos can also preserve for further use using cryopreservations. Assisted hatching method. In some cases, couple can run through with a lot of problems or failures in many cycles of reproductive assistance technology. In other instances, a couple with an older age will face these kinds of issues. Assisted hatching method will help these couples and bring new hope. Initially, it was observed that the embryo is having a thin membrane of zona pellucid and having a higher rate of implantation in other techniques. Usually, the zona pellucida is a thick membrane which covers the ovum. Sperm should dissolve those layers and enter inside the cytoplasm of the egg before fertilization. In the assisted hatching method, changes in the zona pellucida membrane are made. In this way, it will increase the chances of hatching of the embryo and implantation on the uterine wall. Procedure. The embryos of 6 to 8 cells are taken after the fertilization in a small dish. They are stabilized by holding with one side. From the other side, small pipette with an acidified solution is taken and the embryo is treated with that solution. Treatment with the solution will create defects in the zona pellucida membrane. This is the critical method where the procedure with the solution will just prick the embryo during hatching may result in the reduction in the chances of hatching and implantation. Soon after the treatment of embryo with acidified solution, excess of the solution is removed by rinsing. Then they are kept under the incubation for a few hours and later they are transferred into uterus. Use of ART raises unresolved ethical issues. For example, health risk in both parents and their offspring resulting from ART and use of pre-implantation genetic diagnosis to select embryos that are suitable tissue or organ donors for other members of the family. Risk of ART. A threshold increase in ectopic pregnancy, multiple births, about 35% in IVF, increased risk of low birth weight, increased risk of transmitting genetic defects to male children when ICSI is performed. To conclude, no technology is free of disadvantages. However, in ART, the benefit is more and also every infertile couple have the right to use the technology under legislation for their better welfare. Thank you.